Data protection in healthcare, a gap between perception and reality. An analysis of the recent reports on cybersecurity, HIPAA compliance, and data confidence among healthcare organizations. Data is a valuable asset for any organization, but especially for those in the healthcare sector. Healthcare data contains sensitive information about patients, providers, treatments, outcomes, and costs. This data is used to improve quality of care, reduce costs, enhance research, and support public health. However, this data also faces significant threats from cyber attacks, breaches, theft, loss, and misuse. Therefore, healthcare organizations need to ensure that their data is protected from unauthorized access, disclosure, modification, or destruction. Several recent reports have highlighted the state of data protection in healthcare and revealed a striking gap between the perception and the reality of healthcare organizations. On one hand, healthcare organizations seem to be aware of the importance of data protection and the risks they face. On the other hand, healthcare organizations seem to be failing to implement effective data protection measures and comply with the relevant regulations. We have analyzed the findings of these reports and will show the possible reasons and implications of this gap. Reports on data protection in healthcare. The following reports provide insights into the data protection practices and challenges of healthcare organizations in the United States. The 2020 HIMSS Cybersecurity Survey, which surveyed health information security professionals from various types of healthcare organizations. The 2020 HIPAA Compliance Benchmark Study, which surveyed healthcare professionals from organizations of different sizes and types. The 2020 Data Confidence Index, which surveyed senior executives from healthcare and other industries. Findings on data protection in healthcare. The reports show that healthcare organizations have a high level of awareness and concern about data protection, but a low level of confidence and compliance. The reports also indicate some of the factors that contribute to this gap, such as budget constraints, staff shortages, lack of training, and evolving threats. The reports suggest that healthcare organizations are well aware of the importance of data protection and the risks they face. For example, 96% of healthcare organizations in the Data Confidence Index agree that cybersecurity is a key factor in securing their data. 86% of healthcare organizations in the HIPAA Compliance Benchmark Study say that HIPAA compliance is a priority for their organization. 75% of healthcare organizations in the HIMSS Cybersecurity Survey report that they have experienced a significant security incident in the past 12 months. These results indicate that healthcare organizations recognize the value of their data, the potential impact of data breaches, and the need to comply with the regulatory requirements. However, the reports also show that healthcare organizations have a low level of confidence and compliance in their data protection capabilities. For example, only 26% of healthcare organizations in the Data Confidence Index have confidence in their ability to protect their sensitive data. Only 10% of healthcare organizations in the HIPAA Compliance Benchmark Study pass the HIPAA compliance audit. Only 29% of healthcare organizations in the HIMSS Cybersecurity Survey have a comprehensive security program in place. These results indicate that healthcare organizations are struggling to implement effective data protection measures and comply with the regulatory standards. The reports also identify some of the factors and challenges that contribute to the gap between awareness and action in data protection. For example, 51% of healthcare organizations in the HIPAA Compliance Benchmark Study cite budget constraints as the biggest barrier to HIPAA compliance. 43% of healthcare organizations in the HIMSS Cybersecurity Survey report that they have a shortage of cybersecurity staff. 39% of healthcare organizations in the Data Confidence Index say that they lack adequate training on data protection. 35% of healthcare organizations in the HIMSS Cybersecurity Survey say that they face evolving and sophisticated threats. These results indicate that healthcare organizations face various resource, skill, and environmental challenges that hinder their data protection efforts. To close the gap between perception and reality of data protection in healthcare, we recommend that healthcare organizations team up with the National Healthcare Security Alliance, which is a leading partner for security and compliance in the healthcare sector. By partnering with the National Healthcare Security Alliance, healthcare organizations can benefit from the following resources: a comprehensive oversight program that covers all aspects of data protection, including governance, risk management, compliance, incident response, and education; access to experienced healthcare security and compliance professionals who can offer guidance, best practices, and support for data protection initiatives; a robust GRC platform that automates and simplifies the data protection processes, such as policy management, risk assessment, compliance reporting, and audit preparation; risk and vulnerability management resources that help identify and mitigate the threats and weaknesses that affect the data protection posture of healthcare organizations; membership in a network of peers and experts who can share insights, experiences, and solutions for data protection challenges. By leveraging the expertise and resources of the National Healthcare Security Alliance, healthcare organizations can enhance their data protection capabilities, meet their compliance obligations, and reduce their exposure and risk. Data protection is not only a legal and ethical requirement, but also a strategic advantage and a social responsibility for healthcare organizations. Therefore, we urge healthcare organizations to take action and join the National Healthcare Security Alliance today.